Hi, my name is Dr Bethany Rushworth, and today's talk is all about building your portfolio and strengthening your CV. This is a really important topic for several reasons, which I'm going to come on to. But first of all, I would like to say thank you so much to AJ for asking me to be a part of this extremely valuable charity webinar series. It's for a fantastic cause, and also thank you to all of you who've signed up to the webinar series yourselves and contributing to the charity as well. Another thanks is to Dr. Ryan Howells. This is a topic which I have spoken about previously, including in a lecture with him in 2020. A lot of the content in this lecture today is repurposed or even worded how he put it into our presentation. So therefore, thank you very much to him for his time and effort in helping me put together what I hope is a really valuable talk. So first of all, a little bit about me. Like I said, my name is Bethany Rushworth. I qualified in 2016 from the University of Leeds. I'm the current editor of the Oxford Handbook of Clinical Dentistry. We're in the 7th edition of this book, and I think it's basically known as the Dental School Bible, so you may have heard of it already. I've worked with various companies such as Wesleyan, Colgate, Practice Plan, Oroscoptic, and others listed here in various capacities, doing talks for them, lectures, workshops, writing for them, product advice, and even sort of student and customer relations advice. So I have a few different roles and on editorial boards. I really enjoy getting involved with companies within dentistry, discussing strategy with them, but my particular interest is helping young dentists and dentists early on in their careers and helping companies to access and assist these groups of dentists themselves. I've lectured at international conferences and been a panelist at the Dentistry show, lots of speaking engagements, lectures, podcast interviews and publications in the press, media, dental and non-dentals and newspapers and magazines. I've got various experience in general practice in the NHS, private practice, working in a hospital setting in maxillofacial surgery. And I also am a certified life coach. So I have my own coaching business where I help young professionals in particular to achieve clarity, fulfillment, work out what they want to do, where they want to go, and then assisting them in achieving that. So that's a little bit about me so far. And hopefully today's talk will give you some ideas about how I got involved with these things and ways that you can too, because in general, I do feel that one thing can lead to another, and there's lots of ways which you can link existing experiences together to give you more opportunities in the future. So the aims and objectives for today's talk are to have a clear understanding of why a strong CV and portfolio is important, have confidence and inspiration to improve your portfolio and CV, because sometimes we just don't know where to start, feel a bit lacking in motivation, and it's also quite easy to doubt yourself and think, wow, they've got a really impressive CV, but then not quite know how to get there yourself. Also a bit of imposter syndrome sometimes. It's important also to understand how to self-assess where you are, and then you can identify areas to develop. So we're going to be going through that as well. Another aim is to appreciate the snowball effect, which I'm going to come into, and how to build on existing achievements, which I've just briefly mentioned. And then realizing when to say no and yes, so appropriate and proportionate energy allocation. So this is something I'm really interested in and I believe really strongly in, is that it's so important that you're investing a proportionate amount of energy into things that you do compared to how much you're going to get out of them or the benefits. And then objectives. So I'm going to explain to you the importance of the strong CV and portfolio, demonstrate how to self-assess your CV. I'm going to explain a bit more about maximizing your achievements. And then we will go into a discussion about saying yes and no and working out kind of when it's appropriate to say yes and no to different opportunities or requests. So to begin with, why is this important? And of course, it seems obvious you need a CV in order to get a job in most cases anyway. And the reason, so that kind of seems obvious, the reason why you would need a CV is to get a job. However, it's becoming increasingly important to have a standout CV or to have done something slightly different. A lot of the time, our CVs can look quite similar. So in general, as dentists, we've all done really similar things before uni, during uni, and even in the early days after uni. So having something which makes you stand out from the crowd is quite tricky. Now, competition is something which seems to be ever increasing within the field of dentistry. Competition for jobs, for Instagram followers, for patients, and just some underlying competition between professionals, it seems. So often there can be lots of other applications for different jobs and opportunities. And we're not just talking about getting your next job in general practice. And this could be for anything. So whether it's a role on an advisory board or an editorial board, whether it's getting involved in something outside of clinical dentistry, in general, there's a lot of competition these days because quite a few people are trying to achieve the same endpoint. So being aware of the competition and making yourself stand out is really crucial. Like I said, there's a lot of similarities between different dentists and their CV and portfolio, and it can be really difficult to stand out. But this is when thinking outside the box comes in useful, because it's a way that you can make yourself look a bit different from your competitors. And it is something that's really challenging. So we'll go into ways that you can think beyond just the standard opportunities that present themselves to you at university. It's really necessary and crucial to look beyond what is just there and obvious. So, for example, just doing things which are standard dental student opportunities, even year representatives, that kind of thing. They're all great, but there's so much more out there which you could do, which would make you seem a little bit different, or potentially make you seem like you're using your initiative a bit more than some of your peers. Personalities. So there's a lot of common personality traits among dentists. They can be quite hostile. I know this is a bit of a sweeping statement and a generalization, but it's quite a hostile environment within dentistry. It's a lot of high achieving professionals who want to do their best, they want to stand out. And I do think that it can be quite difficult, especially if you're maybe not wanting to put your head above the parapet. Then it's even more important that your CV speaks for you. And then opportunities. So it's really important to have a good CV so that you're prepared for opportunities that can come your way. And like I've said, one thing can lead to another. So the better your CV is, the more ready you are to jump on opportunities that you spot or think of, the better. It can also be harder to do certain things after you leave education or a hospital environment, such as getting publications, again, something else I'm going to come on to. But with time, these things can get more difficult to get back into. So the stronger your CV is earlier on, the better. So to go into a bit about confidence and the inspiration to improve, you deserve to be where you want to be in your life and to achieve what you want to deserve, whatever you want. So your dental career is a lifelong journey. And this is something which is really easily overlooked. And especially when you see dentists in their sort of mid to late 20s who seem really sorted, they've achieved everything they want to achieve within dentistry potentially, or they've opened a practice, or they have this label of cosmetic dentist, that kind of thing. It's quite easy to forget that you can still carry on developing beyond that and think, oh, I'm in my late 20s and I don't own a practice. Is it too late? And it really isn't. So trying to remind yourself that whatever you want to achieve, you deserve, and there's no time limit on being able to get there. So keep focusing on the lifelong journey of dentistry and how you can continually improve and better yourself. So it's important to identify what you want and where you want to be, because this will really help inspire you to start working on your portfolio and to get better. If you don't know where you want to be or what you want to be doing, then it can make you feel a little bit lost, and it can be really difficult to figure out where to focus your energy. Now, of course, this doesn't mean that you need to know exactly the specialty or the end point, say if you're a dental student, but it's important to know what kind of things you want to be doing more of and what you're enjoying. Setting short, medium, and long-term goals is also really important, because if you just have the long-term goals, these can seem completely unattainable and overwhelming. If you only have short-term goals, then it can be quite difficult to lose sight of the bigger picture, well, easy to lose sight of the bigger picture and difficult to keep motivating yourself when you don't know what the end point is that you're working towards. So I really recommend breaking down your goals into short, medium, and long term. And I personally use something called Trello. So that's Trello, which is a free online service, or it is at the time of recording. And you can basically make online boards, and you can put lists on there, rearrange things, tick things off to-do lists. And it's a very dynamic kind of editable system. So I put a lot of my goals and planning onto Trello and find this is really useful, especially in a career capacity. And try not to focus on what everyone else is doing. This is so difficult in a world where comparison is so rife, and you can see directly through social media what the dentist down the road is doing, or people you went to uni with, or your colleagues. Try really hard to focus on what you want and remind yourself of why you're doing things rather than looking where everyone else is at. Because in general, myself included, only tend to post the highlights, and people trying to keep things like social media a positive space. It can be really easy to consume all of this and think everyone else is doing things that you aren't. So for self-assessment and improvement, there's 3 different steps which I recommend to looking at where you are and figuring out where you need to be. So for phase 1, where are you now? It's important to look at where you're at currently. So write out your CV in as much detail as possible. This can be cut down for specific jobs and opportunities in the future, but try and put everything on there. So it can seem a bit ridiculous at first, but making sure anything you've ever done is documented. And it really helps if you do this as you go along. So having a master CV that's contemporaneous, and every time you do anything, whether it's a talk, an article, a blog post, get it written on that master CV. You can then cherry pick from there things which you need for specific opportunities or job applications, and it keeps everything together and in one place. I would also recommend saving your certificates, reflections, and feedbacks in a folder as soon as possible. So if you go to a course or a CPD event, immediately afterwards, make sure you've got your CV, write your reflection, do your feedback, and then put it together in a, say, a plastic wallet in a folder, so that all of your documents and CPD things are all together, and it makes it a lot easier to get them out if you need them, if you ever need to have a review of them. But also when you come to applying for a job, you can take this folder with you, for example, as a portfolio for DCT, but in general practice as well. So having a really good documentation of all the courses you've done is really useful. And then also planning ahead. So look ahead at the year. So think about where you are, plan ahead in terms of making sure you've got all the documents you need for the year sorted, do your EPDP as early on as possible, and then you can start planning for things which you need to work on throughout the year. Phase 2 is looking at where you're lacking. So you want to aim for balance and keeping your CV well populated in all different areas. And I'm going to give you a checklist on a following slide of the different areas which you need to focus on to get a balanced CV. But as soon as you identify where you're maybe lacking, where there are some gaps, you can focus on these and add them onto your yearly plan or your short-term goals. For example, you might think that you've not really done enough on composite bonding, and which is just a prime example at the minute. It's very in vogue, and therefore you could add onto your short-term plan maybe one course, and maybe onto your long-term plan a longer restorative or aesthetic dentistry course. So just by planning ahead, looking at the gaps in your CV, you can start to build it up over a period of time. It doesn't need to be overnight, but that's why planning is so key. And one of my favorite words in this lecture, because it really allows you to start to bulk things up without necessarily having to panic or rush. And then phase 3, which I've sort of started, is filling the void and then re-review. So anywhere there's gaps, focus on these and aiming for a mixture of short-term and long-term commitments. So it's really tempting to go for as many short-term gains as you can. So blog posts, articles, things you can do really quickly, turn them around, populate your CV in that way. But at the same time, this is something which doesn't really demonstrate a huge range of skills, and having 50 blog posts but nothing else doesn't necessarily show a range of skills. So trying to focus on a mixture of short and long-term commitments and projects is really useful. And then keep re-reviewing. So don't just think, oh, I filled in that void, I can sit back and relax. Keep re-reviewing your CV and looking for ways which you can add to different areas, whilst keeping in mind it needs to remain balanced. So here's a self-assessment and improvement brief checklist. I have one in more detail, which again, I'll share with you in a moment. So the general topics are publications and press. So whether this is any kind of academic writing, scientific journals, peer-reviewed journals, newspapers, magazines, blogs, articles, even YouTube, websites, anywhere which you're putting out content. Speaking and presenting, so lectures, courses, talks to dental students, that kind of thing, even careers fairs, they're all useful to make a document of. And then work and environment. So ideally trying to get some work experience in different types of environment if you can. I think that's really useful to show different experiences and insight into different areas of dentistry. Charity and education, so ways you've maybe contributed towards different good causes, different charities, teaching, helping students or helping peers, helping colleagues, even training dental nurses if you're qualified, that sort of thing. And then further training and qualifications, so ranging from a whole range of things from MFDS, MJDF, all the way up to PhDs and other postgraduate degrees. So some ideas, this list is taken directly from Ryan's part of the lecture, which we co-presented in 2020. So thank you again to Ryan. Try thinking outside the box. So sports and hobbies are great. Again, I'm going to break all of these down into smaller sections shortly in more detail, but sports and hobbies, conferences, lectures and courses. So there's so many out there. A lot of them are now available online. You can attend them for free. And there's also ways of getting lectures and courses for a really reasonable price as well. So things like this webinar series where you can get loads of content, loads of CPD, really useful. Volunteering and charity work, committee positions, which again, I'm going to go into more detail about. Writing articles for websites and magazines. This is a really great place to start. Loads of opportunities out there, personal websites and blogs. Various jobs, essay prizes, so the list really goes on. There's a lot of different ways you can start adding onto your CV, and some of you may have ticked boxes in all of these areas, but in general tend to find that a lot of people have a much heavier weighting in one area than another, and keeping it balanced is really useful. So first of all, hobbies. So consider the purpose of any hobby that you mention in your CV. If you are going to put something on your CV, it needs to sell you in some way or show how you're good for the job. Does it show a long-term commitment? Does it show stress relief? Because obviously it's really great if you can demonstrate a way that you can clear your head, have a life outside of dentistry, or maybe it's going to show some teamwork and technical skills. Now, for myself, I've got various hobbies, things I enjoy doing. I know due to the pandemic, this lecture's clearly pre-recorded, so I'm not sure where things will be by the time it's aired, but at the minute a lot of our hobbies are restricted, but over time hopefully you've developed some, and there are still things which we can be doing to clear our heads and develop all of these different skills. So it's really important when you're considering what hobbies to include on your CV to just be sure why you're putting it on there. Every single word on your portfolio or your CV, whatever you want to call it, needs to have a purpose. So you need to be showing something useful from including it on there. There's no point in just putting walking if you can't back that up with a reason why that hobby is being included on that list, or why it makes you more employable or suitable for an opportunity. So conferences, lectures and courses. Now, quality and quantity can both be important here. Of course, the more learning that you're doing, the better. But also it's really useful to focus on the quality of any kind of course, lecture or conference that you're doing, because our time is extremely valuable. As dentists, a lot of us maybe don't have that much spare time. So it's crucial that if we want to have a really good work-life balance, enjoy ourselves as well, and potentially for it to not be all about work, then making sure we're investing our time as well as our money in high quality opportunities and courses. So like I've said before, planning is one of my favourite words of this lecture. Plan these out in advance to try and maximise what you're going to get out of them. There's no point in duplicating things multiple times in a year if you don't need to. And often there's a specific sign-up date. Some of the really popular courses get sold out straight away or very early. So as long as you're aware of all the deadlines, then it's really useful if you've planned in advance to be able to get signed up and balance your year as you go along. Like I said previously, try to keep contemporaneous records and reflections. So making sure that whenever you've been on a course, you immediately get the certificate, a hard copy ideally, reflect on it, write your reflection and make sure everything's ready. Like I've said, I've kept things in plastic wallets, so per course or per lecture, I'll put it in a plastic wallet all in one folder, so it just keeps everything together. You could subdivide it into different types of dentistry or different specialties, whatever you feel more comfortable doing, but the more organised the better. And it takes quite a long time to go back through these things and sort them out. So if you can do it as you go along, fantastic. Or if not, try and set yourself a target when you're going to get it all sorted by, and then keep on top of it from then onwards. Courses, conferences and lectures also are great networking opportunities. So it's something which I found is a fantastic way to meet other dentists, and especially if you're picking out your courses carefully, then it's likely that you're going to be meeting really like-minded dentists, like-minded lecturers, speakers, and it's a really good way to meet new people and also opens more doors to more opportunities. For courses, my top 3 tips for picking a course is thinking about when can you apply the knowledge or skill. There's no point, in my opinion, as a foundation dentist going on a really complex restorative course where you're going to be learning things that you just won't be doing in general practice. Not only will you feel disheartened that you can't practice them, you're going to go back to work and you're going to forget what you've learned. You're not going to be able to put those skills to good use. So really, it's a bit of a waste of time at that point to be doing the course. So trying to consider how soon will it be before you can apply the knowledge or skill. The next thing is how long is it going to take to make your money back? So this isn't really important, but it's definitely something to consider in my opinion, is that if you're going to do a course that's really expensive, if you're potentially early on in your career and it's a bit more difficult to get the money together to pay for it, how long is it going to take you to earn that money back? Is it a worthwhile investment? Is it going to benefit you or your patients in the short term, medium term, or long term? And trying to kind of plan these things as you go along. And then also, have you plateaued? So again, in my opinion, there's no point doing a course in something which you've not plateaued at, because if in many cases it's just a case, or it's just saying the word cases multiple times there, a lot of the time it's just a case of needing more practice. So going on a course might not necessarily be the best way to invest your time and money if just some practice at your place of work is going to help you improve rapidly. So for me, I choose to do a course at the point where I'm just starting to plateau and want to take something to the next level. So volunteering and charity work is often overlooked, and when I do coaching with people, it's something which gets highlighted quite a lot in an exercise I get people to do where they rank the different areas of their life, and it's something which many people say, oh, I've never really thought about that, but actually I don't give a lot back. And for many people, this is something which causes them so much satisfaction when they start spending more time investing in helping others. So it's important to consider your motive and the purpose of whatever you're choosing to do. Yes, of course, this is a talk about building your portfolio and your CV, so that could be one of the incentives, but it's definitely useful to think about the cause that you are giving to and why you want to do this. So it could be a short or long-term thing, whether it's your time, your knowledge, or financially. Communication and teamwork demonstration is something which is great that can come out of working for a charity or doing some volunteering, and personal satisfaction and fulfillment. So it doesn't necessarily need to be a skill that you're developing. It might just make you feel really good about yourself, but it's definitely something which can look a bit different on the CV, because from my experience, not that many people have done anything, not that many people have done huge amounts of charity and volunteering, especially if you look beyond, say, electives. So committee positions is another way of really boosting your CV. So getting involved with different committees and panels can be so great, not only to meet other people, but also it can just look really impressive that you've been asked to represent yourself or a company in some way. So there's of course committee positions while you're at university. So library representative, year representative, course representative, that kind of thing. But then there's plenty more opportunities that come up as soon as you finish university. Now, this can take time and patience, and there's not always a shortcut or a quick fix. And again, I often see within dentistry that there's this kind of eagerness to get a quick fix and say, oh, I'll just write this blog post or write this article just to get it out there, get it on my Instagram, put it on my CV. And in many cases, getting to a position of being on a board or a panel does take time. It really takes effort to build your reputation and to get yourself to that point. So try and remain patient, don't be disheartened, and be prepared to start from the bottom and work your way up with these things. There's often long and short-term roles, so it's really important to consider when you are wanting to get involved how much time you have to invest and what you have to offer. Because if you're planning, if it's a say a local representative role and you're planning to relocate, it might not be appropriate to get any kind of long-term position. Whereas if you know you're going to be settled for a while, then maybe you'll have your eye set on something that's a longer arrangement or even a contract. Now, quality is key. So, in a similar way to saying about considering your motives and incentives for going on courses or for any volunteering work, it's useful to consider the quality of any roles which you may be considering. As you progress through your career, you may find that you have less free time to invest in these things, or you may want to invest less time in these things. So, considering the quality of the position is important and being selective. So, it might be better to have one really involved and consuming role rather than lots that you're only giving sort of 50% of your effort to as you go along. And then one thing can lead to another, so and more opportunity. So being involved in anything that's a group or a team can always open doors to more opportunities. So that's something to consider is who else is going to be on this committee and what are their roles, what are they involved in, and really get to know these people that you're going to be working with. If you always show up and give 100% and do your best, then you will start to build a reputation for yourself for great quality work, communication, and just being generally a nice person. So definitely being mindful of opportunities that could arise from how you conduct yourself within committee roles and positions. Articles is something which are really popular in terms of that is quite common. It's generally fairly easy to get started, but it can really take time to be building up to some of the bigger profile publications and newspapers, press, that kind of thing. Dental and non-dental, so demonstrating a variety of writing skills can be really useful, and you might enjoy doing this regardless. So it's a great way to position yourself as a key person of influence within the profession. So share your thoughts, get your name known. There's some arguments for being controversial just to build your reputation or your presence. Personally, I try and stick to the facts, and I think it's really important to only focus on topics which you are comfortable with and confident about. So if you've potentially just qualified from university, you may not be the best placed person to write for magazines about complex implant cases, unless it's like a case report. You maybe wouldn't be advising dentists about implants at that point. So trying to focus on things which you are knowledgeable about and you can answer questions about. And it also helps reduce a lot of stress, because if you're going beyond your capacity or your competence and your knowledge, it can be quite scary to then feel like there's that pressure that you've put yourself out there as an expert on that. It can become quite stressful. So you can start by guest posting and blog on blogs and websites. So reach out to people who've got blogs, ask them if you can write for them. It's really useful if you can give an example of your work, and also a pitch. So sending them details of what you want to do your talk about, magazines and websites, and then newspapers and journals. So that's kind of working up in difficulty level, really. Getting an article published in a scientific journal can be really challenging. It can take a really long time. I'm going to come a bit more onto that in a moment, but really thinking about where you're investing your energy and what kind of thing you want to write about. And then, like I said, sending pitches. So finding the most appropriate person to send a pitch to, try and make it personal, not just a generalized email. I contacted earlier on in my career about 100 different magazines, newspapers, asking if I could write for them. And I think one replied. So that's where I started. But it's a starting point. I wasn't disheartened by the rejections or being ignored. But then I just grasped the one opportunity where I did get to write. And it meant that in future, I was able to use the one I had written as an example of my work, and I could start to build on it from there. So you only need one to get going. On the slide, I've got some examples writing for the Telegraph, dentistry.co.uk, Young Dentist magazine, a few different FMC publications here, and Dental Notebook, which is like an online website, and I did a blog post for them. So there's loads of different ways you can get your name out there, get your opinions, your thoughts, and try and help educate and share your knowledge. So a personal website and blog is also something which can be really useful. Be aware that anyone who's viewing what you put online can see it. So anyone can see what you post. Anyone can often find things, even if you've deleted a photo of Instagram, it may still come up when you Google search you. So just be really aware of everything that you're posting and who's going to see it. Think about your target audience. What are you sharing things for? Who's the intended person you want to see this? Is it other dentists? Is it students? Is it patients? And consider why you're sharing these things. So here's an example of myself and Ryan's website, again taken from our previous lecture. You can put examples of your work on there. Be really careful to make sure that you've got consent to share cases, and be mindful that you are opening yourself up for criticism if you post pictures of your work. Now, a lot of things in dentistry can be a grey area. So if you're posting how treatment plans, things you've done, especially complex cases, it's likely that somebody will have something to say about it. So just be mindful that you could be opening yourself up for criticism on a public forum, and that patients may then see those comments as well. So even how you react to comments on your website or social media is really important. Always imagine that the most important people are going to read what you've posted, and that it's going to be there forever. And think about what people see when they Google you. So for me, my website wasn't there to try and get more patients specifically, but it just increased my presence on the internet. If someone Googled me, I was taking control of what they would see. So ideally, you want the first page or two, or as many as possible, of Google, if someone puts in your name, for it to be dental related, beneficial content that kind of forms a bit of an online portfolio. So maybe your website first, maybe then a social media account, articles you've written, interviews with you, that kind of thing. So if a patient were to look you up, they would start to get to know you and see that you're the real deal from having a few pages of information. And the same if somebody was looking to employ you or to have you work with them on a project. If they Google you and there's nothing, it doesn't really help that much, but forming a bit of an online presence can be really useful in those circumstances. So moving on to jobs, there's so many different options available that I'm not even aware of all of them. There's just so many different things which you can do, different ways you can balance your time, split up your week, that kind of thing. It doesn't matter if you don't know what the end point is, but from experience, it's great to get a variety of settings under your belt. So if you can work in a hospital, if you can work in general practice, of course, that's not for everybody. Many dentists are extremely successful. They graduate, go straight into general practice. However, if you're not sure where you want to end up, trying to be as open-minded as possible and broaden all your opportunities is a really great way to sort of safeguard the fact you don't know where you want to end up, and be able to demonstrate that you've got all these different skills and attributes from a variety of settings. And it's easier said than done, especially for someone who's in the position they want to be in now. I'm not going through, say, national recruitment myself, but try not to sweat the small stuff. So if you don't get your first choice job, this can be really disappointing. I completely appreciate when you're in it, it's horrible. But trying to remind yourself that across your whole career, no experience is bad experience in terms of a job. You'll always learn something. Even if you don't particularly enjoy it for a period of time, any position or role you get, you're going to learn something, because it's impossible within dentistry to not learn with experience as you go along. So try not to be too harsh on yourself. You may not always get your first choice role, but trying to see it as a great opportunity to get a variety of experiences instead. So essay prizes are another thing which can look fantastic on your CV or your portfolio. There's loads of different essay competitions out there which you can find quite easily online. I never entered an essay competition sort of early on in my career, and it's something which I think would have been really beneficial had I done that, if I'd have done well in one, for example. This here was, I've cheated a bit with my pictures. This was winning a presentation at a conference rather than winning an essay prize, but I didn't have a picture to show you. There's loads of undergraduate and postgraduate opportunities. Plan as far ahead as you can. So you need a good few months in general, especially if you're trying to do this kind of thing alongside your studies or your career. So giving yourself a good few months. If you look online, get the dates, make sure you've got all the deadlines written down. I used to always find out about essay competitions after the deadline had passed and think, oh, I wish I'd seen that sooner. And I learned quite quickly, for these things, you need to be organised and planning for the year ahead. Try not to make sloppy mistakes. So make sure your essays are read through by somebody who can guide you, who can just check some of the facts for you, make sure it reads okay. Don't treat essay prizes as just a casual side thing. Really try and put in some effort. And you might be surprised how well you do, because for a lot of these, they really don't have that as many entrances as you'd expect. It's definitely worth picking out a few, getting your head down and getting some essays submitted. So presentations, oral and poster presentations both look fantastic on your CV. You can submit abstracts to conferences and meetings, but it's really important. This is something I didn't know earlier on in my career, that sometimes they'll specify that you can't have used it elsewhere. So if you think one is a better opportunity than another, it might be worth saving that presentation or that abstract for a specific conference, or if you think you've got a better chance of being accepted, just try and plan in advance for when you're going, what you're submitting to where, and where you're going to get the most benefit from. Oral prizes generally are better than poster prizes, just because a lot of the time you'll be able to present a poster or have a poster up at a conference, and then a select few get to actually present. So just being aware of what prizes are available, what opportunities are available, and even if you don't know where you want to end up again, going into a variety of settings. So here I was lecturing at a student conference about oral surgery, and then the slide on the right, I was lecturing at an international head and neck cancer conference. So these are totally different. Well, I guess they're both surgical, but totally different audiences, different topics that I was talking about, but they still looked really good on my CV, even if I wanted to do something unrelated to surgery. So don't turn away opportunities like this just because you might not know what you want to do, but also don't put too much pressure on yourself to have a specific niche at this point. And then practice presenting and keeping to time. This is really difficult because a lot of the time you'll only have a 10-minute speaking slot, sometimes even less, and it can be so challenging to get all of your content, especially if it's something you're passionate about or enthusiastic, trying to get all of your content into that time slot. But often they will cut you off at that mark. So as soon as the time runs out, the time will be cut off and then they'll move on to questions. So you really don't want to be caught out before the finale of your presentation. And then get feedback. So not only while you're practicing, get feedback from friends, colleagues, relatives, whoever's happy to help you, but also make sure you get feedback from the people who've watched your presentation. Is there any way you could have improved it? Course conference organisers, sometimes they're happy to give you feedback, because it's really useful to know what you're doing well and maybe what you're doing not so well, so you can improve for the future and increase your chance of getting an award or a prize and building your reputation as a good public speaker. So case reports are another thing which are really, really great on your portfolio or your CV, and in general, fairly easy to get under your belt in certain circumstances and if you approach it the right way. So in hospital settings, so if you're doing a restorative core training job or max fax surgery, anything like a teaching job, it's likely you're going to see some of these interesting cases more often, and it can be a bit more easy to go about, especially approaching it with patients compared to the hustle and bustle of general practice. Personally, I always had access to a consent form, so I made sure I wrote a basic consent form that was thorough but not overwhelming for the patient, and I had 3 copies. I'd always have that in my pocket in my scrubs when I was working in MaxFax, for example. If I then saw an interesting case, I could consent the patient there and then for it to be used as a case report. and I would get them to sign the 3 copies, one for me, one for their notes, and one for them to take home. And this was really useful for me to get quite a few case reports published, because I immediately consented the patient, and it's so easy to lose them once they've left the hospital. You never see them again. And you think, oh, I wish I'd got consent for that. So trying to make sure you have consent forms with you. Some journals do have their own consent form, and this can be really difficult if you're not sure where you're going to submit your case report to. You may find actually you can't submit it to everywhere because you've not got their specific case report consent form. However, if you've even just got a basic one, it gives you some options. And then if you really wanted to, for example, submit to the British Journal of Oral and Maxillofacial Surgery, you could recontact the patient if you'd got their permission to do that. But in a lot of cases, once the patient's been discharged from hospital, they're not going to bother filling out case report consent forms and sending them back. So it's just useful to have one with you, and then if you're lucky, you might get them to fill out a specific one. Ask around, consultants, lecturers, colleagues, they might have cases that you could write up. A lot of the time, people further on in their specialty training aren't as desperate to get basic case reports written, but they may have some that are available for you to do. So asking around and get guidance and support. So for the first one I wrote, I asked a consultant to help me sort of oversee what I was writing, just to make sure that I was approaching it the right way and it was factually accurate. So here's a couple of examples of case reports I've had published. And again, these are during my Max Fax year, and just making sure that the patients were consented as I went along. Now, audits are not research, but they're something which are really useful to have. In many jobs, that you have to do them anyway. So things like auditing your radiograph quality, or auditing notes, that kind of thing. So it's important that you understand what an audit is and that you are clear that it's not research. So the audit loop is basically where you identify a standard, you audit to see whether the standard has been met. If not, you then implement a change, and then you have to re-audit to check that the change has led to an improvement, and that can close the audit loop. So being aware that the re-audit at the end is really important that's a crucial thing to understand. And then you can make audits into poster or paper presentations, and you can present them even at conferences a lot of the time. So I've got friends and colleagues who've won awards for poster presentations presenting an audit. So if it's something novel, something interesting, then definitely try submitting it and maximize the time and effort you've spent doing the audit to try and get something else out of it. So original research is something which is really difficult to get involved with. It's not something many dentists manage to achieve, especially if you're doing a single year contract job such as DCT1. It's often easier in a research post, or if you're sticking around for a couple of years somewhere. I personally have been involved with original research, but I haven't led my own study. And I think that's quite normal, especially at this point in our career and with the path I've taken. That being said, it doesn't mean you shouldn't try. It looks excellent on your CV. Speak to people about joining existing work. So as soon as you take on a new role, for example, if you start DCT1 or 2, immediately start putting feelers out for any projects on the go, because they can really take a long time, and it's not really fair if you expect to jump in at the last minute. So at least if you can commit a year to something, that's better than nothing. Work hard, pull your weight, and start early. So make sure that if you are getting involved, you really do make an effort. And this may mean being a bit of a dog's body and having to fill out forms or number crunch or do things which are really boring. But if you're hoping to get some of the reward from being involved, you also have to be prepared to get stuck in and help out where you're asked to. So further qualifications, diplomas, masters, PhDs, there's loads of ways you can get some postgraduate training, and these will have varying difficulty, effort and expense. Now, if you've done any further qualifications, further degrees, if you've done the MFDS or MJDF exams, you can get extra points on core training applications, specialty training applications. So it's always worth having a little look in advance at what's going to get you extra points if you're considering these kind of training pathways. but it can also look really good to future employers if you've got extra skills and qualifications. It's likely if you do well, almost certain if you're going to do a master's or a PhD that you're going to get a publication or some presentations out of it. So that's something to consider as a bonus, but it can be quite expensive to take time out to do some of these qualifications. So it is very important to consider your motive and the incentive for doing these things, whether you really need to, whether it's going to directly benefit you or change the treatment that you're providing, and whether there's an alternative. So you may find that doing something part-time will really help your patients, but it will also be a bit more manageable for you. So having a look at your different options and different ways you could get these extra skills in the best way that suits you. Now, awards, scholarships and bursaries. These could be academic or clinical. There's loads of different types, and they're going to vary from undergraduate awards. So usually there's somebody's name award for endodontics, that kind of thing. And they can postgraduate, there's the same, there's loads of different awards available. Some of these are self-nominated, and I know this is a little bit of a touchy subject. A lot of dentists get shot down for it, but you've got nothing to lose by entering, and you can't win it if you aren't in it. And again, questioning your incentive for doing this, it can look really great to patients, but also if you do enter an award, such as the Private Dentistry Awards, you're not going to be put forward for the award unless you enter. And by winning it, you're kind of demonstrating that amongst everyone who's nominated themselves, you've done something to stand out. And you're not harming anyone by entering, you're not cheating anyone. Obviously, you have to be mindful of how you promote yourself if you do win one of these awards. So saying, I am officially the best young dentist in the country could get you into some trouble. But saying that you've won this specific award, I think in my opinion, there's no problem with that. And it definitely just shows that you've gone above and beyond in some way. And if you don't agree with these awards, fair enough, each to their own. And there can be some bias. I think it's because these awards are impossible to anonymize, because you're saying who you are, who you know probably could come into it at some award ceremonies, because if you're really involved, it's often the same names and the same faces who are involved in all of the different areas. So you're probably more likely to win an award. And it's a bit of a chicken or egg situation, in that if you've got your fingers in all the pies, you're going to stand out more, you're more likely to win the award. But then did you win the award because you were involved? So it's quite difficult to really pinpoint, but don't be disheartened if you don't win. But equally, I would say you've got absolutely nothing to lose by putting yourself out there, applying for an award. It can look amazing to patients. It looks good to future employers, in my opinion, because ultimately, whether it's self-nominated or nominated awards, you're up against somebody else and were deemed to have something that made you stand out. So moving on to maximising your assets. So a lot of the time we're looking for new ways to do things, new ways to improve our CV or portfolio, when actually if we take a step back and look at what we've already done, what's already there, are there ways that we can improve on this and sort of develop and use the opportunities we've already had? So for example, if you've written a blog post for somebody and they start doing a podcast, you could reach out to them and ask if you can do a podcast with them. Or if you've done an audit, can you then turn that into a poster presentation? If you've written an article or a case report, could you submit that to a competition? So looking at things which you've had to do or are doing or are currently doing, and trying to get more from that one achievement. If you're on a committee, can you do something within that committee to boost yourself further? Is there a promotion or a higher position that you can work towards? So rather than always feeling like you've got to start from scratch, considering whether or not you can work with what you've already got to make it better. And then another thing which I found really key, especially within dentistry, is the snowball effect. So one thing will often lead to another thing, which often leads to another thing. If you show up 100% all of the time, you're always doing your best, then it's likely that you're going to start getting known for what you're doing and a reputation in a positive way. So if you, for example, go to a meeting You show up, you're chatting with people, you're networking, you're showing, you're enthusiastic, you're showing an interest, it's likely that one of the people there might remember you. If an opportunity then comes up and you spring to mind, then they're potentially going to ask you. So try and see everything that you do as sort of marketing yourself and an opportunity for something else to arise. So definitely being mindful, especially within dentistry. Everybody knows everybody, it's quite a small world, and so many different companies, organizations, opportunities are all linked. So a bit like what I said about the awards, where chicken or egg, if you get involved with one thing, it will probably lead to you getting involved in another thing, and you start to get this snowball effect, like a snowball rolling down a hill where it builds up and gets bigger and bigger. The more you do, the more opportunities that there will be, and the more that will come from that in itself. When that starts to happen, it's really important to be clear on when to say no and when to say yes. So the importance of appropriate energy allocation, or proportionate energy allocation, which would be the PEA, is crucial. We have such a busy time at work as dentists. It's back to back, non-stop in many cases. It's really difficult to switch off. You don't necessarily want all of your spare time to be completely consumed by more work, even if we want to continue progressing. So being clear on how much energy you're going to have to put into something and then how much you're going to get out of it is really important. Now, this doesn't mean only say yes to things that massively benefit you, but earlier on in your career, it's likely you'll have to say yes to more of the rubbish or things you don't really want to do. And gradually, as the snowball effect starts to occur, you start to do more and more. You can be a bit more selective about what you say yes to and what you say no to. And this doesn't always have to mean just saying no, full stop. You can say thank you so much, but at the minute I have so much on my plate. I don't feel I'd be able to give 100% to this opportunity, and I wouldn't want to let you down. However, I'd be really interested in getting involved in the future. Should another opportunity arrive, thank you so much for considering me. So some kind of response worded like that doesn't necessarily just shut you out, but it is protecting yourself, your time. And for me, I would much rather give 100% to fewer things than to try and spread myself too thinly and not be able to provide and offer the best that I possibly can. So considering that you're considering your reputation, considering how you want to be perceived is really crucial when you're taking things on, and trying not to necessarily say yes to too many things if you're not going to be able to sustain them or juggle them. It's really important to be mindful of your own mental well-being, your mental health, and how you're coping, and starting to recognize the signs of burnout when you're doing too much, and being able to continually reassess how much you've got on your plate. So rather than just taking on more and more and more, getting more stressed, make sure you're clear on your triggers, what is making you feel overwhelmed, and at what point you really need to start saying no. There will always be more opportunities, and sometimes we'll be more tired than others. Sometimes we do have to make sacrifices socially or push ourselves to get our portfolio where it is. But that being said, it's also really important to be enjoying our career and seeing it as a journey, rather than putting too much pressure on ourselves to have it all now, and rushing just for the sake of getting to a milestone which we've maybe set for ourselves, which is going to cause us some damage along the way. I really hope that that was insightful and gave you some different ideas, inspiration about building your portfolio, improving your CV. If you have any questions, please don't hesitate to get in touch at bethanyrushworth@live.co.uk. I assume my email address will not be changed or updated before this is aired. So as it stands, this is the best way to get in touch with me. If you have any questions or would like any further guidance, then please do reach out. Massive good luck, and thank you again for joining this webinar series. It's for a fantastic cause, and we're really happy to have you here and being part of the talk.